Number one was nothing but there was decrease in the venous return. And this decrease in the venous return led to decrease in the cardiac output. Second that we learned was there was tachycardia and hypertension. Why did this happen? Because the peritoneal stretch happened. The peritoneal stretch can basically activate the sympathetic nervous system, and this system can increase the heart rate, and it can also increase the systemic vascular resistance, thereby increasing the blood pressure. And next is third that we saw was it can cause bradycardia. How? By activation of peritoneal stretch that can basically lead to activation of vagus nerve. Now you see here we are saying that their heart rate is increased. Here we are saying there is bradycardia. Now it depends upon which nerve got activated. If vagus nerve is getting activated, which is part of the parasympathetic nervous system, automatically there is going to be decrease in heart rate. If at all you are saying that the sympathetic nervous system is getting activated because those nerves got stretched, then that will cause increase in the heart rate. So it depends. So fourth one is it can cause what is called as hypercarbia. Hypercarbia is what? It is nothing but respiratory acidosis. That is the equation that we mentioned already, that this CO2 can basically combine with the H2O in the blood and form H2CO3. That will basically break down into H+. This H+ is a strong logarithmic determinant of what? It is a strong logarithmic determinant of the pH. Small changes in the H+ concentration can literally shift the pH. HCO3 is also produced, but that HCO3 is more of a buffer, and that compensation also occurs over days. If at all you are saying that H+ is increased in the blood, yes, sure, that HCO3 will come and act as a buffer. But that bicarbonate, the buffering system will get activated in days. Activation of the buffering system means that you are starting to reabsorb that bicarbonate from the kidneys, right? So that will take some time. The next complication that we can see is the atelectasis. Why is the atelectasis occurring? Because of the increase in the intra-abdominal pressure that is shifting the diaphragm a little upwards, and that causes or it forces the lungs to accommodate in an area that is much smaller. They need more area to expand. You are literally taking that area off them. Tip pain in the shoulder, guys. Shoulder tip pain. Again, this is because of irritation of the diaphragm. What else can occur? There can be, gas embolism. There can be gas embolism. If the venous needle was put in the wrong place, suppose it was put in the inferior vena cava and then CO2 insufflation was done, that would cause gas embolism. Other thing it can cause is it can cause ischemia of the mesentery. Again, the increase in the intra-abdominal pressure will basically, compress all those vessels which are supplying the viscera. These are nothing but the splanchnic vessels. So these are all the complications, guys, of pneumoperitoneum.